Let me ask you this time, if you are a pediatrician or a doctor, how many times you have come across when you see children whose parents are very worried and they say, doctor, my child has got a high fever or my child has got a high temperature. And every now and then, I mean, whether in the hospital, whether in the community, sometimes even at your home, people, they want you to see their children simply because they've got high temperature or because they've got fever. So there are a lot of like sort of a misconceptions surrounding the concept of fever. So I thought I would take this opportunity to settle down a few facts, try to differentiate between the fever facts and myths, and try to clear some of the confusion surrounding fever in children. So my name is Dr. Said Kazmi and you're watching my YouTube channel. So without further ado, let's dive in and get started about this, clarifying the concepts, the misconceptions surrounding fever in children. Now, what is fever? Fever basically is a body temperature of, if you are using the American Fahrenheit scale, then a body temperature of greater than 100.4 degree Fahrenheit, which equals 38 degrees Celsius on the British side. And so if any child has got a body temperature of greater than 38 degrees Celsius or 100.4 degree Fahrenheit, we call it fever. Now remember, fever is a symptom, it's not a disease. Fever simply means that there is an inflammation or probably infection going on in the body, but it doesn't tell you what is exactly causing that inflammation or infection. If most of the time in kids, people are worried because we have seen 80-90% of the time fever is because of viral infections or some other infections going on in the body. So remember, fever basically helps fight the infection by turning on the immune system. The fever is there for a reason, because the body thermostat brings the temperature up so that the immune system kicks in, and that activated immune system that helps to fight off the infection, whatever infection the child has got. So there is a lot of what we call as fever phobia. There is like a fear surrounding the fever, that fever is a bad thing, and rather than focusing on the underlying causes, people are more worried about the face value of fever. Patients or parents, they think often that fever will hurt their child or their children. They worry and they lose sleep when they see their child has got a fever, and as I told you, that this is called as fever phobia. Now I just want to tell you the medical fact is that fevers are harmless. They're completely harmless. So there are a few myths that cause fever phobia. Let me talk about those fever fits. Number one. So one myth is that all fevers are bad for children, that if fever is occurring, that is definitely bad for the children, and at any cost that temperature needs to be brought down. Number two, another fever myth is that fever can cause brain damage. People also think that fever can cause seizures in anyone. Another myth surrounding fever is that the fever is high. The higher the fever is, they think that the cause is quite serious. They also think that all fever need to be treated by fever medicine, whether paracetamol, ibuprofen, or any other medicine. They think that the fever needs to be treated, and they think that if you don't treat this fever will keep going like higher or maybe forever. And they also think that if you cannot bring the fever down with medication, they think that the cause is serious. And also another myth is that they think if you treat the child with fever, that will make the infection go away faster. So these are some of the common myths that are surrounding fever in children. So let me clarify these myths and tell you what are the facts. So we'll go one by one, okay? So let me tell you about a few facts that would clarify these myths, okay, and that every parent should know. Number one is that temperatures below 100.4 or 38 degrees are normal. So if somebody has got a temperature of 37.6 or 7 and they take it as a fever, they are wrong. They are not a fever. The body temperature goes up during the day, so it fluctuates. It goes up during the day and comes down during the night. So don't make the mistake of treating normal temperatures, because the temperature would be at like 37.78 during the evening time. So don't consider it as a fever. This is very, very important. Number two, any fever that is between 38 to 39 degrees Celsius, that like varies between, or 100.4 to 102 degrees Fahrenheit, we call them as low grade fevers. Okay, we doctors, they call them as good fevers, because here the immune system kicks on in at these temperatures, and it helps to fight infection. So if you are bringing this temperature down, you are basically not helping the immune system to kick off. So we doctors call it as good fevers. Fact number 3 that the parents need to know is that fever helps the body fight infection. So it turns on the body immune system. Remember, fever is a defense response. It is not only found in humans, it's also found in animals. And these temperatures between 100 and 104 degree Fahrenheit, they actually help sick children get better. So this fever is actually the body's own response to get the child better quickly. Now, what are high fevers? High fevers are temperatures of 40 degree or more. So 104 degree Fahrenheit or 40 degree or plus, like 40.5, 41. I mean, they are higher. I mean, we call it high temperature, but they're still not harmful. High does not mean harmful. 40 degrees Celsius and above is high fever, but still not harmful. Remember, most of the times fever with infection, they stay below 104 degree Fahrenheit or 40 degrees Celsius. The reason is the brain has got a thermostat in a portion called hypothalamus that keeps the body at the best temperature to fight the germs. This is the body actually decides what's the best temperature to fight the infection that the child has got. So they can sometimes go even higher, like up to 105, but even that would equate around to 40.5 or 6 degrees Celsius. But even that temperature is harmless. Remember that temperature is harmless. Remember, fever from infections, they don't cause brain damage. Only fevers above 42 degrees Celsius, and this is very, very important. I mean, people think, oh, you're at 40 degree Celsius temperature, and they start panicking. No, the actual cutoff level is 42 degrees Celsius, which equates 108 degree Fahrenheit. Only temperature at this level or above can cause brain damage. But remember, the temperature up to, like, beyond 42, they are very, very rare. This can only happen, let's say, if a child is left in a closed car during very hot weather, so the temperature can quickly go above 42 degrees, heat stroke and things like that. But usually during infection, it doesn't go that high. So only temperatures above 42 degrees Celsius can cause brain damage. Keep this thing in mind, okay? Another fact that the parents should know is that seizures, if they think that fever causes seizure. Now remember, seizures triggered by fever are uncommon. I mean, obviously some would think about febrile seizures, which occur in children between 6 months to 6 years of age. But if we take as, like, the population of children as a general population, then only 4% of children can have a seizure from fever. I know these seizures because of fever are quite scary to watch. Most of these febrile seizures, they stop within 2 minutes, and they don't cause any permanent harm. So, like, for example, if you think that febrile seizure would cause learning problems or they would cause epilepsy, no, like febrile seizures, 1 attack or 2 attack, it's sort of the risk of getting epilepsy from this is equal to the epilepsy in a normal population. That's around like 1 to 4%. Other thing is that most fevers with viral infections, which is quite common in the children age group, they usually last 2 or 3 days or maximum 3 to 5 days. But most of the time the average is between 2 to 3 days. Now these fever will go away and not return once the body overpowers the virus. So it's a viral infection, it's a limited infection, it would go away in a couple of days. Now most often this is day 3 or day 4, the child has got high temperature or let's say mild to moderate temperature for 2 to 3 days. On day 4 or day 3, usually this temperature goes away. When using fever medicines, expect that the fever to keep coming back after the medicine wears off. That is quite normal. Many parents, they bring the child, say we have been giving paracetamol or ibuprofen. It brings the temperature down, but as soon as the effect wears off, the temperature goes back up. Now that is quite normal. This is not abnormal. I mean, the temperature has to stay there for 3 to 4 days. There is an underlying viral infection as a reason for that thing. So don't expect that you give 1 or 2 doses and the fever would go away and not return back. The fever is going to come back. Sooner or later, the fever is going to come back. So this is a fact because there is an underlying viral infection or maybe any other infection as a reason for that. If your child is well and feels warm to touch, just because they feel warm to touch, they probably don't have a fever unless until you've documented it with a thermometer. Remember, because children can feel warm for many reasons. For example, if they are playing too much, they can feel warm. If they've been crying hard, they can feel warm. If they get out of a warm bed, they can feel warm. Or if they were in a hot weather, they can feel warm. So they are actually giving off heat. Their skin temperature should return within like 15 to 20 minutes after the exercise or whatever was the environment. So just hot to touch is not fever unless until you have checked it with the thermometer, okay, and the child feels well otherwise. Yes, if your child acts sick and feels warm to touch, then they probably have a fever. And if you want to check it, you should have a good quality thermometer to check it. But I mean, you don't need to keep like checking it again and again. You probably can think that they might have a fever, okay. So to summarize it, I would say look at your child. Even if you've got a thermometer and you've been checking it every, like let's say, couple of hours, don't go nuts like just keeping temperature and becoming anxious on the readings. Look at your child, not the thermometer. We as the doctors, we look at the overall picture, not just like one or two symptoms. So how your child looks is what is important. The exact temperature number is not. Even if a child has got, let's say, 39, 40 degree and he otherwise seems well, you don't need to worry. While a child who's got a low temperature but seems unwell would be, that would be taken more seriously. So if your child looks or acts very sick, then the cause is more likely to be serious, regardless of the temperature levels. But the level of fever tells us very little. Remember, viruses and bacteria can both cause high fevers. Remember, both of them can cause high fevers, and most of them are like self-limiting conditions. Virally, most bacterial, maybe you can give them antibiotics. Some of the bacterial infections are also self-limiting, but nevertheless, I mean, fine, bacterial infections can still have be a reason to give antibiotics, but not the viral infections. So, coming down to the million-dollar question, when to give fever medicines? Do you need to give it every time? Do you need to give when the child has got fever? Or no, you have to look for certain things. So let's answer this question. So the first thing is, doctors and nurses don't always agree on when to treat fevers. Okay, there's a lot of like sort of a disconsensus, variations on this. There are different schools of thought. Now, fever only needs to be treated if they cause discomfort. Now, remember, most fever, they do not cause any discomfort unless and until they go above 40 degrees Celsius. The discomfort at low fever, let's say 38.5 or 39, is probably due to pain. For example, this might be associated with acute pharyngitis or tonsillitis, so that is giving throat pain, sore throat. That discomfort is because of the pain, not because of the fever. Only give fever medications if the fever is higher than 102 degree Fahrenheit or 39 degrees. So if you need to give paracetamol or ibuprofen, only give if it crosses 39 degrees Celsius, because fevers are needed to fight the infection. Libra fever is a good thing. Most of the time, treat fevers with one medication. So use either paracetamol or ibuprofen in the correct dosages. Don't give both medications together, like unless until there is a good reason. Remember, with treatment, most of the fevers, they come down about 2 degrees Fahrenheit, which is actually 1 degree centigrade. So they don't often like come down to normal. So that if the temperature might come from 39 to 38, but it might, I mean, it's not necessary that the temperature needs to come down and touch the baseline, and that's fine. And also, when the fever medicine wears off, expect the fever to go up again. That's also normal. Many times the parents bring, they say, we have been giving paracetamol and ibuprofen and we know it's a viral infection, but the fever is coming back. So what else? The fever is going to come back. I mean, this is quite normal for the cycle of the infection. Like, let's say the infection is going to stay for 3 to 5 days. Expect the fever to come back when the medicine effects wear off for let's say for the next 3 to 5 days. So these are a few facts about the fever that you are a doctor, you also need to know about that, and as a parent you also need to tell these facts to the parents to bust those myths which are there in their mind regarding fever in their children.